Orders of the day. Ordre du jour.
Orders of the day, government orders, government bills, commons, consideration at second reading of Bill C-45, the Cannabis Act.
Ms. Wilson-Raybould, seconded by Ms. Shagger, moves that Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, be now read a second time and referred to the Standing Committee on Health. Debate. The Honourable Minister of Justice.
Well, thank you, Mr. Speaker. It is my privilege to speak today about Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts. Bill C-45 proposes a framework to restrict and strictly regulate access to cannabis in order to protect the health and safety of Canadians, to keep cannabis out of the hands of young people, and to keep the profits out of the hands of criminals. I introduced Bill C-45 on April the 13th alongside another important piece of legislation, Bill C-46, which proposes new and stronger laws to more seriously tackle drug and alcohol-impaired driving. In the 2015 speech from the throne, our government committed to legalizing, strictly regulating, and restricting access to cannabis. This commitment is motivated by a recognition that Canada's existing approach to cannabis, one of criminal prohibition, is not working. It has allowed criminals and organized crime to profit while failing to keep cannabis out of the hands of young Canadians. In many cases, it is easier for kids to buy cannabis than cigarettes or a bottle of beer. Statistics tell us that the current system of criminal prohibition is failing. Youth in Canada use cannabis at some of the highest rates in the world. A 2013 UNICEF report found that teenagers in Canada use cannabis more than teenagers in any other developed country. The 2015 Canadian Tobacco, Alcohol and Drugs Survey found that 21% of Canadian youth aged 15 to 19 and 30% of young adults from age 20 to 24 reported using cannabis. Mr. Speaker, the current approach to cannabis has created an environment where organized crime reaps billions of dollars in profits from the sale of illicit cannabis, and thousands of Canadians end up with criminal records for non-violent minor cannabis offences each year. A majority of Canadians no longer believe that simple possession of small amounts of cannabis should be subject to harsh criminal sanctions, which can have lifelong impacts for individuals and which take up precious resources in our criminal justice system. Our government agrees that there is a better approach. Bill C-46 or 45 paves the way for Canada to become the first G20 country to enact legislation to legalize and strictly regulate cannabis at the national level. The overall goal would be to protect the health and safety of Canadians with a particular focus on protecting our young people. Our government understands the complexity of this initiative. That is why we have taken a cautious, evidence-based approach. To ensure that our legislation would be informed by evidence, my colleagues, the Minister of Public Safety and Emergency Preparedness and the Minister of Health and I, announced the creation of a task force on cannabis legalization and regulation on June 30th, 2016. Its mandate was to advise our government on the design of a new regulatory system. The task force conducted extensive consultations across the country, visited the United States of Washington and Colorado, both of which have legal access to cannabis for non-medical purposes, and considered nearly 30,000 online submissions sent in by Canadians. It also sought the views of a diverse community of experts, professionals, advocates, frontline workers, youth, Indigenous communities and organizations, government officials, law enforcement, citizens, and employers as set out in its mandate. All Canadians owe a debt of gratitude to the chair of the task force, the Honourable Anne McClellan, and the 8 other distinguished members, all experts in their own right, and all of whom volunteered significant amounts of their time throughout the second half of 2016. The task force delivered its final report on December the 13th of 2016, entitled A Framework for the Legalization and Regulation of Cannabis in Canada. The Chair described this final report as the result of a truly national collaboration, featuring a diversity of opinions and expertise expressed by those who gave their time and reflections. I would invite members who may wish to inform themselves of the complex and cross-cutting issues and challenges associated with cannabis legalization to have a look at this substantive piece of work. The report has been very well received, is comprehensive, and provides important background information on the issues this bill seeks to address. The task force is comprised of over 80 recommendations for the development of a cannabis framework in Canada. It reflects a public health approach aimed at reducing harm and promoting the health and safety of Canadians. The recommendations fall under 5 themes. First, in taking a public health approach to the regulation of cannabis, the task force proposed measures that will maintain and improve the health of Canadians by minimizing the potential harms associated with cannabis use. Second, the task force called for the creation of a safe and responsible supply chain and recommended the design of an appropriate distribution system. The task force noted that government's principal interest should be to establish an efficient, accountable, and transparent system for regulatory oversight of the supply chain, emphasizing the protection of health and safety and reducing diversion to the illicit market. It recommended that wholesale distribution of cannabis be regulated by the provinces and territories. Third, the task force highlighted the need for clear, enforceable rules to ensure that all Canadians and law enforcement agencies understand what is permitted and what continues to be prohibited under the new legal regime. The task force also heard that penalties for contravening the new rules will need to be proportional to the contravention, and that the criminal justice system should only be employed where truly necessary. Fourth, the task force recommendations for a regulatory framework for non-medical cannabis were informed by the existing rules governing the medical system. These rules establish safeguards to ensure product quality and security, as well as safety provisions to prevent diversion. Fifth, the task force report underscores that the regulation of cannabis is a complex public policy issue. As with other such issues, the depth and scale of the complexity increases as we turn to the practicalities of implementation. Our government recognizes that it will be necessary for all levels of government to coordinate efforts in order to implement an effective regime. We remain committed to working with our provincial and territorial counterparts, as well as with municipalities, to develop a framework that strictly regulates access to cannabis in a way that works for everyone involved. Mr. Speaker, building on the recommendations of the Task Force on Cannabis Legalization and Regulation, our government has proposed legislation that pursues a new approach to the regulation of cannabis. The approach sets national standards and will be more effective at protecting public health and safety, keeping cannabis out of the hands of youth, and reducing the role of the illegal market and organized crime. Our government's commitment to legalize and strictly regulate cannabis marks a major change for Canada. But I am convinced that what is proposed in Bill C-45 is the best approach for Canadians. Mr. Speaker, I would like to speak to a few components of Bill C-45. I would like to begin by highlighting the overall or overarching purpose of the bill. Simply put, its purpose is to protect the health and safety of Canadians. Specifically, it aims to protect the health of young people by restricting their access to cannabis, to protect young people and others from advertising and other promotional activities that are likely to encourage them to use cannabis, to provide for the lawful protection of cannabis, to reduce illegal activities in relation to cannabis, and to deter illegal activities in relation to cannabis through appropriate sanctions and enforcement measures, to reduce the burden on the criminal justice system in relation to cannabis, to provide Canadians with access to a quality-controlled supply of cannabis, and to enhance public awareness of the health risks associated with cannabis use. Mr. Speaker, I want to emphasize that while our government is legalizing cannabis, we are also strictly regulating and restricting access to it. Bill C-45 will create a new legal framework that will allow adults to access legal cannabis through an appropriate retail framework, sourced from a well-regulated industry or grown in limited amounts at home. Adults 18 years or older would be permitted to legally possess up to 30 grams of legal dried cannabis in public or its equivalent in other forms. Adults could also legally share up to 30 grams of dried cannabis or its equivalent with other adults. Selling or possessing cannabis in order to sell it would only be lawful if authorized under the Act. Under no circumstances could cannabis be sold or given to a young person. Production of cannabis would also have to be authorized under the Act. Possession, production, distribution, importation, exportation, and sale outside of the legal framework would be illegal and subject to criminal penalties. These penalties would be proportionate to the seriousness of the offence, ranging from ticketing up to a maximum penalty of 14 years imprisonment. This reflects a measured approach to meet our legislative objectives. Mr. Speaker, Bill C-45 would exempt young persons from criminal prosecution who possess up to 5 grams of cannabis. Our government has proposed this approach because we do not want to expose young people to the criminal justice system for possessing what amounts to be very small amounts of cannabis. For possession or distribution of more than 5 grams, young people would be subject to the provisions of the Youth Criminal Justice Act, which emphasizes community-based responses that promote rehabilitation and reintegration. For less serious offences, alternatives to charging are encouraged, such as taking no further action, warning the young person, or referring the young person to a community program or agency to help address the circumstances underlying their offending behaviour. Moreover, our government will be engaging with the provinces and territories to encourage them to create provincial offences that would apply to youth possession under 5 grams of cannabis. This would provide police with the authority to seize cannabis from a young person while not subjecting them to the consequences of criminal liability for these small amounts. This would be similar to the approach that has been taken in the context of alcohol. Such a measured approach for youth is consistent with the task force report, which stated that simple possession for youth should not be a criminal offence, but that sanctions should focus on adults who provide cannabis to youth. It is also consistent with the substantive body of evidence concerning the heightened risks of cannabis use for young persons, including the effects on brain development. This approach will also address our objectives of keeping cannabis out of the hands of youth while ensuring that they do not enter the criminal justice system for minor possession offences. Mr. Speaker, Bill C-45 will allow cannabis producers to promote their brands and provide information about their product, but only where young persons would not be exposed to it. These limits are reasonable. They would allow adult consumers to make informed decisions while responding to the greater risks that cannabis poses for young people. Under the proposed legislation, the federal, provincial, and territorial governments would all share in responsibility for overseeing the new system. The federal government would oversee the production and manufacturing component of the cannabis framework and set industry-wide rules and standards. The provinces and territories would generally be responsible for the distribution and sale components of the framework. They would also be able to create further restrictions as they see fit, including increasing the minimum age in their jurisdiction to, for example, align with their drinking age, as well as lowering possession limits for cannabis, which could be pursued to further protect youth. Further, the provinces and territories, along with the municipalities, could create additional rules for growing cannabis at home, including the possibility of lowering the number of plants allowed per residence and restricting the places in which cannabis can be consumed. In addition to working with the provinces and territories to establish a secure supply chain, jurisdictions will be key partners in our government's efforts to raise public awareness about the potential risks associated with cannabis use. Mr. Speaker, our government believes in evidence-based policy. We will monitor patterns of and perceptions around cannabis use amongst Canadians, especially youth, through an annual Canadian Cannabis Survey. The data gathered will inform and refine further public education and awareness activities and to mitigate the risks and harms of use. In this regard, as spelled out in Budget 2017, existing funding of $9.6 million will be directed to public education and awareness and monitoring and surveillance activities. I can also tell you, Mr. Speaker, that our government intends to offset the broader costs associated with implementing this new system by collecting licensing and other fees, as well as through revenues generated through taxation. This is currently what we do in tobacco and alcohol industry. Subject to approval by Parliament, our government intends to bring the proposed legislation into force no later than July of 2018. At that time, adults across Canada would be able to legally possess up to 30 grams of dried cannabis or its equivalent when in public. They could share up to 30 grams of dried cannabis or its equivalent with other adults. They would be able to purchase dried or fresh cannabis or cannabis oil from a provincially regulated retailer or online from a federally licensed producer in jurisdictions that have not put a regulated retail framework in place. Adults could choose to grow up to 4 cannabis plants per resident, subject to a height restriction of 1 meter. They could also make legal cannabis-containing products, provided that dangerous solvents are not used. Mr. Speaker, upon coming into force of the legislation, adults would be able to legally purchase fresh and dried cannabis, cannabis oils and seeds, or plants for cultivation. Other products, such as edibles, would become available at a later date once federal regulations for their production and sale have been developed. I would note as well that the current program for access to cannabis for medical purposes would continue under the new Act. This is in keeping with the task force recommendation to initially maintain a separate medical access framework in order to support patients. Our government has been clear that to meet its objectives of keeping cannabis out of the hands of kids and the profits out of the hands of criminals, there needs to be a legal means by which adult Canadians can purchase cannabis. Our government's objective is to provide room for the provinces and territories to establish a distribution or retail system that align with their unique circumstances. Recognizing that some provinces and territories may not have systems set up and running upon royal assent, our government is proposing to facilitate access for Canadians to a regulated, quality-controlled supply of cannabis through a secure mail system via existing licensed producers. I would like to conclude, Mr. Speaker, by encouraging all members to support Bill C-45. I know that the status quo is not working. All members of this House understand that we must do better, especially for our youth. The proposed legislation represents a balanced approach designed to protect the health and safety of Canadians. It will provide adults with a regulated access to legal cannabis while restricting access to youth. It will put in place strict safeguards to protect youth from being encouraged to use cannabis and create new offences for those adults who either provide cannabis to youth or use youth to commit cannabis-related offences. By reducing the demand to the illicit market, the proposed regime would also cut the profits of criminal organizations who are benefiting greatly from the current regime. Mr. Speaker, Bill C-45 would also help reduce the burden on police and the criminal justice system with respect to non-violent minor offences. In addition, the bill proposes to strengthen the laws and enforcement measures to deter and punish more serious cannabis offences, particularly selling and distributing to youth and selling outside of the regulatory framework. Mr. Speaker, following the debate at second reading, I urge all members of this House to support Bill C-45 at second reading and refer it to committee. Thank you, Mr. Speaker.
Questions and comments? Question and commentaire. The honourable member for Niagara Falls.
Thank you, Mr. Speaker. And I have two quick questions for the Minister of Justice. She indicated that this whole bill is based on evidence-based policies, and she said that's the policy of her government, but yet she must be aware of the fact that the Canadian Medical Association has already come out with their stand on this, that the use of cannabis would have significant psychological impacts on brain development until the age of 25. In addition, the Canadian Pediatric Society considers the dangers of a young person purchasing marijuana or using marijuana until the age of 25, that they're jeopardizing their brain health. Well, if it's evidence-based policies, wouldn't she agree that this is completely inconsistent with that? And she mentioned at least on 6 occasions during her speech that the Liberals were very interested in protecting youth. I would ask her, is there any easier way for young people to get marijuana than if their parents have got 4 plants in the kitchen? Is there any easier way for them to have access than that? I'd be interested.
The Honourable Minister of Justice.
Well, thank you, Mr. Speaker, and I thank my honourable colleague across the way for the 2 questions. I'm very pleased to have introduced Bill C-45. It is an evidence-based piece of legislation that seeks to put in a complex regime to legalize and strictly regulate cannabis in this country. It is based on a substantive task force report that traveled across the country, received over 30,000 submissions with respect to how we can put in place a complex regime for legalization. And in terms of evidence around the age and the legal age in terms of being able to access a legal supply of cannabis, this was something that the task force weighed in on. In terms of balancing the necessity of protecting the health and safety of young people and the recognition of the impacts that there may be on brain development, we had to balance that reality with another reality that the greatest numbers of individuals who are currently smoking or using cannabis is among young people. So we had to balance the 2 realities in terms of putting forward our position with respect to the legalization and regulation. And in terms of protecting youth, in terms of home grow, having 4 plants, 1 meter high, this is providing the ability for individuals to grow in their homes, recognizing that adults would, as they do with prescription drugs or alcohol, provide security and safety measures in order for young people that may or may not live in their home or access their home be protected against having access to those
Questions and comments. The Honourable Member for Cowichan, Malahat, Langford.
Thank you very much, Mr. Speaker, and I appreciate the Minister's speech on C-45. I was pleased to hear in her speech that she noted that criminal prohibition is not working and is indeed failing. She also noted that the majority of Canadians support the end of criminal prohibition punishment. And indeed, even if we go back to the Liberal platform of 2015, it noted that arresting and prosecuting for cannabis offences is expensive for our criminal justice system. It traps too many Canadians in the criminal justice system for minor, non-violent offences. Now, the Liberals have repeatedly said that they want to legalize, strictly regulate, and restrict access in order to keep it out of the hands of kids and the proceeds out of crime. I accept that. I don't think she will find any argument in this House against that. My question is in her preamble, she seems to have made a very strong case for decriminalization. She has acknowledged the harms that criminal prohibition and punishment does to our society, particularly youth and racialized Canadians. This government has now been in power for almost 20 months. Many regimes around the world have instituted decriminalization quite well. I still have not heard a good argument from the Liberal government why they will not institute this as a good interim measure on the road to legalization.
The Honourable Minister of Justice.
Well, thank you, Mr. Speaker, and thank my honourable colleague for the question and thank him for reiterating the purpose of why we're introducing this legislation. We're committed to legalizing, strictly regulating, and restricting access to cannabis. And the reasons, as he clearly articulated, is to keep it out of the hands of children and the proceeds out of the hands of criminals. By simply decriminalizing right now, we will not be able to achieve those objectives. That is why we are working very diligently, benefiting from the substantive input that we receive from the task force and Canadians right across the country to ensure that we put in place, working with the provinces and territories and municipalities, this complex regime for the legalization and the strict regulation of cannabis. And that's what we're focused on. We're very hopeful that this legislation will move through the parliamentary process and that we will have a legal regime in this country in order to achieve the objectives that I stated in my remarks in terms of keeping it out of the hands of kids, proceeds out of the hands of criminals, and ensuring that for minor possession offences that we're not criminalizing young people or adults.
Questions and comments. The Honourable Member for Sarnia-Lambton.
Well, thank you, Mr. Speaker. I'd like to thank the Honourable Justice Minister for her speech. What she says is very nice, but it doesn't accurately reflect what is in the bill, specifically with respect to protecting and keeping cannabis out of the hands of children and youth. In addition to the 4 plants in the household, which if she would refer to poisoning data, you'll see that kids eat plants all the time because their parents don't put them up in the cupboards.
That's true.
We've also got the provision in this bill to allow 12 to 17-year-olds to have up to 5 grams, which I understand is about 10 joints. Does she not agree that that will put cannabis in the hands of the youth, and in fact they will probably become the drug mules at the school?
The Honourable Minister of Justice.
Well, I thank you, Mr. Speaker, and thank my my honourable colleague across the way for the questions. I want to be clear. There is nothing in Bill C-45 that provides the legal ability for young people under the age of 18 to legally access cannabis. In terms of the 4 plants that she referenced, as I noted in the previous question, certainly this is necessary in the responsibility of adults in the home to take precautionary measures to prevent young people from gaining access to the plants, such as they do for alcohol or prescription drugs. In terms of the 5-gram limit that the honourable member mentions, this is to put in place or not to criminalize young people for possibly having in their possession less than 5 grams of cannabis. We are working very closely with the provinces and territories, encouraging the provinces and territories to put in place offences in terms of less than 5 grams possession for young people. Along the same lines of what happens with respect to alcohol, we are going to continue to have these conversations with the provinces and territories to ensure that we are covering all of our bases and ensuring that this complex regime is put in place and recognizes the differences between and among the different provinces and territories, potentially using the permissive nature of the legislation to adapt to their respective jurisdictions, whether that be around age, whether that be around home grow.
Questions and comments. The Honourable Member for Salaberry-Sirois.
Thank you, Mr. Speaker, and I thank the Minister for her speech on C-45. What I deplore and have deplored since the announcement was made about this bill is that the Liberals are not announcing any additional money for prevention. We're told that the bill is there to protect young people and their health. They want to reduce their access to marijuana, but what I'm hearing in the field from stakeholders, be it youth centers, group homes, people working with youth crime, or mental health, the consumption of drugs is something for which there's not enough money. The government announced less than $2 million a year, but that's not just for marijuana, that's for all drugs, for everything to do with healthcare in general. If you compare this to Colorado, in 2015 alone, $45 million was allocated regarding the legalization of marijuana. Here, there's a lack of vision. They are setting aside the effect this could have on mental health, on social behavior, the rest of the lives of young people. There could be impact on brain development. We're still analyzing the effect of the levels of THC from a scientific standpoint. We need to have the means to catch up with our ambitions here. I'm waiting to hear the government invest more. There's nothing in the last budget about prevention. This is critical. Order, please. Unfortunately, time is limited. The Honourable Minister of Justice.
Well, thank you, Mr. Speaker, and I really appreciate the question from the honourable, my honourable colleague across the way in terms of prevention. I couldn't agree more that our government needs to continue the work that we're doing to ensure, building on the work of the task force that raised awareness around the legalization and regulation of cannabis. We need to ensure that we're taking, and we are ensuring that we're taking a public health and safety approach, and to make sure we use the $9.6 million that was mentioned in budget 2017, but also recognize that we're going to have to continue, and we're committed to continuing, to have a broad-based public education campaign that speaks to the detrimental impacts of cannabis on brain development, that speaks to the impacts and relationship with respect to mental illness. I know my colleague, the Minister of Health, is committed to continuing to have this discussion. I know that she's going to be presenting before this Honourable House in a couple of days, and I would invite my colleague to ask her about the specific measures, but this is a firm commitment of our government to ensure, in putting in place a complex regime for the legalization of cannabis and the strict regulation, that we do the necessary work to ensure that we're communicating effectively and that we provide the education measures that are required for Canadians to understand the regime that we're putting in place.
Resuming debate, the Honourable Member for Niagara Falls.
Thank you very much. Mr. Speaker. I'm pleased to rise in the House today to share some thoughts regarding Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts. Essentially, this bill proposes to regulate and legalize the production, possession, use, and distribution of marijuana across Canada. Now, Mr. Speaker, the government is on record saying they want to implement this by July of next year. The government's decision to move hastily on such an important piece of legislation concerns me. Let me be clear. This marijuana bill will have far-reaching impacts on every part of our society. It's imperative that before proceeding with the significant changes to the criminal code, a thorough debate takes place in this House for all members who wish to speak. I'd like to take a minute to outline some of the areas of concerns that I have with this legislation. One of the major issues I have with this legislation is the fact that it will be putting children at risk of having much greater access to marijuana. And I'm sure this concern resonates with parents of young children and teenagers. Now, while the government has consistently touted that one of their objections is to prevent young people from accessing cannabis, in reality, this bill does just the opposite. Clauses 8 and 9 of the legislature are a perfect example. These provisions state that it's prohibited for an individual to possess or distribute more than 4 cannabis plants that are not budding or flowering. This means that it will be legal for people to grow at least 4 marijuana plants inside their homes. I don't know of any easier way. I said that in my question. I can't imagine an easier way for children to access marijuana than that way. Because unlike prescription pills, which you can put away, the marijuana plants by definition have to be out in the open, and so I can't imagine any easier way for children to get a hold of marijuana when their parents are starting to grow it in the kitchen. Now, my concerns for children and teenagers don't end there, Mr. Speaker. Consider the dangers for young people who may come in contact with marijuana edibles. Now, this is an issue that is not properly addressed in C-45. I've seen photographs, as I'm sure you have, of these edibles. They are indistinguishable from candy treats or baked goods that are often found on the kitchen counter, in the kitchen cupboard, or even in a cookie jar, enticing prizes for young children. They are so convincing that an adult could mistake a pot edible for being the real candy, the real thing. The possible health risks for children ingesting these kinds of edibles cannot be underestimated. And according to healthcare professionals, such as Dr. Robert Glatter, the consumption of multiple servings of edibles at one time for any age group results in various potential psychological effects, not to mention the possibility of oversedation, anxiety, or psychosis. Ingesting multiple servings on a short time span can also produce intense anxiety, paranoia, and even psychosis. These adverse side effects are more frequent among first-time users. Now, if these are the health risks that affect adults ingesting edibles, one can only imagine the danger they pose to children, who are almost certainly going to be first-time users. In fact, experts from the Department of Justice have attested that edibles pose significant risks to the health of children. Clearly, the entirely plausible chance that children may accidentally ingest these edibles clearly deserves a more careful examination by the members of this House. Another illogical aspect of this legislation that the government must address is the ambiguous rules regarding the quantity of marijuana that children may legally possess. As we've heard, Mr. Speaker, according to C-45, Clause 8, subsection C, children under the age of 18 are prohibited from possessing the equivalent of 5 grams of marijuana or more. Now, what happens then, Mr. Speaker, when a 12-year-old uses or distributes cannabis to his peers on the playground every day with no questions asked? This is a lax approach. How can the government ensure that children and teenagers will not be recruited by organized crime? I can see that is what is going to be happen. On a simpler front, is it safer to be in possession of 4 grams of cannabis or 5? Or is the safest quantity possession and distribution of 0 grams? That's what our party would support, Mr. Speaker. Mr. Speaker, the Liberals will tell Canadians that 4 grams is okay, but the Conservatives, on the other hand, are firm in our conviction that 0 grams is the only safe amount for our children. The Cannabis Act is replete with arbitrary cutoffs that do nothing to protect our children from the dangers of marijuana, and in fact, we believe they expose them to greater risk. Canadians deserve clarity when it comes to legislation that will significantly affect so many aspects of our justice, health, and public safety systems, and more importantly, their daily lives and families. And it's not enough, I'd like to point out, it's not enough to say we're going to shove all these things over to the province and let them figure out. There's a responsibility, Mr. Speaker, of the federal government in this here to get it right. If all these problems with accessibility alone were not sufficient to highlight the shortcomings of Bill C-45, Mr. Speaker, please note that the Prime Minister and his government proposed that the legal age to purchase marijuana be 18 years of age. Now, for a government that claims to espouse product evidence-based policy, this provision is clearly off the mark, and all you have to do is just ask any doctor, health organization, or health expert. For one, the scientific evidence overwhelmingly concerns that the human brain does not fully develop until individuals reach their mid-20s. The Canadian Medical Association, as I've pointed out, has already warned the government that the use of cannabis may have significant psychological impacts on brain development up till the age of 25, and they recommend that 21 be the youngest acceptable age to legalize the purchase of marijuana. And indeed, the position of the Canadian Pediatric Society likewise urges the government to consider the dangers of so young an age to purchase marijuana. Again, they keep talking about protecting children, but they completely ignore the evidence. Indeed, the co-author of that position paper, Dr. Christine Grant, has stated at the very least the levels of THC must be limited until after the age of 25 to be considered safe for brain health. Once again, C-45 lacks crucial information. Why are the Liberals ignoring this crucial scientific information that has a tangible impact on the health and best interests of Canadians? And it's not enough to say we're ignoring all the evidence and let the provinces figure this out, Mr. Speaker. That is not good enough. Further, while drafting this legislation, the Liberals government had plenty of time to study the impact of marijuana legalization in several jurisdictions in the United States. And instead of learning from those mistakes and challenges that have befallen these states, the government has decided to ram this legislation through, and again, this will be a complete detriment to Canadians. Now, I'll give you a couple of examples of what we're talking about. First is the fact that our American counterparts have found an increase in impaired driving following the legalization of marijuana in certain jurisdictions. In fact, at the U.S. Department of Justice have found that, quote, on Colorado roads during the year following legalization of marijuana, there has been a 32% increase in deaths related to marijuana impaired driving. That is completely unacceptable. There is little doubt that Canadians will see a similar increase of drug-impaired driving if marijuana is legalized. In fact, statistics have already shown that this is a serious problem. According to the Canadian Student Tobacco, Alcohol and Drug Survey, nearly 1 in 5 Canadian high school students have been a passenger in a car whose driver had recently smoked marijuana. Canadians of all ages are very confused about the many existing myths regarding smoking and driving. For example, in a 2014 poll, 32% of Canadian teens believed that driving high is less dangerous than driving drunk. The perpetuation of this kind of thinking will have serious consequences, Mr. Speaker. A report prepared by the Canadian Centre on Substance Abuse states that Canadians 16 to 19 years of age are more likely to drive 2 hours after ingesting marijuana than they would be 2 hours after drinking. The World Health Organization, on the other hand, has been clear in debunking this myth. They have stated, quote, evidence suggests recent smoking is associated with substantial driving impairment, particularly in occasional smokers, with implications for work and safety-sensitive positions or operating a means of transportation, including airplanes. Complex human-machine performance can be impaired as long as 24 hours after smoking a moderate dose of cannabis, and the user may be unaware of the drug's influence. Now, in light of this information, C-45 does not provide sufficient avenues to educate young people about the undeniable danger of driving high. Now, should the government insist on ramming this legislation through, they should seriously take into account the importance of public awareness campaigns in protecting young people. Ultimately, actions speak louder than words, and legalizing marijuana sends the wrong message to young Canadians that pot is a benign judge that is not any cause for concern. In reality, this government cannot guarantee that more children and teenagers will not be injured in motor vehicle accidents, if not worse, as a result of increased access to marijuana. This, beyond doubt, is something the government should have considered seriously before trying to ram this bill through Parliament in an attempt to live up to a campaign promise. Another important and threatening problem is facing jurisdictions that have legalized marijuana is the increase in cannabis-related hospitalizations. We've already established, Mr. Speaker, that the research that proves marijuana can be dangerous, have dangerous effects on children's brain development and overall health. In Colorado, now these studies have had far-reaching and tangible consequences. According to a recent report by the Colorado Department of Health, hospitalization involving patients with marijuana exposure and diagnosis tripled from around 803 per 100,000 in 2001 to 2,413 per 100,000. Not, Mr. Speaker, that's about 3 times as many people were hospitalized. This serves as a cautionary guideline for how children will be impacted by easy access and exposure to pot. A report by the Rocky Mountain HIDTA states that, quote, the number of Colorado children who have been reported to a poison control center or examined at a hospital for unintentional marijuana exposure annually has spiked since the state legalized recreational cannabis. These statistics are not inconsequential. Once again, Mr. Speaker, why has this government ignored the lessons that our peers have faced after legalizing marijuana? Answers to these challenges are certainly not found in Bill C-45. The gaping holes in this legislation are indisputable. If homegrown marijuana plants are permitted, coupled with alarming and unanswered questions related to marijuana edibles, children will clearly have easier access to the substance. And given the bill's ambiguity and how much cannabis constitutes an offense, children and teenagers may possess and distribute up to 4 grams of marijuana with no clear recourse to protect them. Setting the age of majority for marijuana use at 18 promotes a lax approach to brain development and public safety. Finally, the government's unwillingness to acknowledge the fact that comparable jurisdictions have faced crucial health and safety challenges as a result of similar legalization processes is not only reckless but unfair to Canadians who put their trust in their members of Parliament. Mr. Speaker, while the risks to children constitute my greatest concern with Bill C-45, there are numerous other problems that go unaddressed in this legislation. One of these is the fact that the bill provides little or no clarity on the degree of flexibility that the government will allow provincial governments and municipal law enforcement to implement this. Additionally, it does not sufficiently address the costs for retraining officers given the changes to the criminal code. Moreover, the questions surrounding the Canada-U.S. border crossing should legalization take place is particularly worrisome to me, as my constituents in Niagara Falls live right across from our American neighbours and often have the occasion to travel to the United States, and taking note of the fact that most American border states have not legalized recreational marijuana, the discrepancy in policy could greatly impact, among other things, the waiting time to cross the border. Now, the former U.S. ambassador to Canada, Bruce Heyman, has expressed his doubts regarding the efficiency at the border and the legalization of marijuana. His primary concern is the fact that Border Patrol dogs are not trained to distinguish marijuana scents from other prohibited items. He stated, and I quote, "These dogs are trained to have reactions to certain scents. Some of these scents start with marijuana, others are something that are significantly more challenging for the border. But the dog doesn't tell you that this is marijuana or that this is an explosive. The dog reacts, and these border guards are going to have to appropriately do an investigation, and that could slow down the border down," end of quote. My constituents and all of the 400,000 Canadians who travel the United States every day deeply are concerned about the waiting times, and they want them to be as expeditious as possible. How can the government ensure that these delays won't affect Canadian business people, families visiting loved ones, or even Canada-U.S. relations writ large, Mr. Speaker? Bill C-45 is silent on yet another important consideration for Canadians. Mr. Speaker, it's evident that the government has been too hasty in its attempt to push through this legislation without consideration of all the risks to children, confusion surrounding implementation, delays at border crossings. This complex issue could result in insurmountable health and safety burdens in the years to come. As such, I urge my fellow members to take the significant problems with this legislation into consideration. So to conclude, I would like to move, seconded by the member for Kitchener-Conestoga, that the motion be amended by deleting all the words after the word "that" and substituting the following. This House declines to give second reading to Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, since this bill makes homegrown marijuana more accessible to children. Thank you very much.
Mr. Nicholson, seconded by Mr. Albrecht, moves that the motion be amended by deleting all the words after the word "that" and substituting the following. This House declines to give second reading to Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, since the bill makes homegrown marijuana more accessible to children. Questions and comments? Questions et commentaires. The Honourable Parliamentary Secretary to the Minister of Justice.
Thank you, Mr. Speaker, and I want to begin by acknowledging the comments of my honourable colleague, who I have much respect for. But there are a number of flawed assumptions in those remarks, which I'd like to highlight now as it relates to his interpretation of Bill C-45. And the first is that somehow children will have lawful access to cannabis. And I want to assure the honourable colleague that C-45 in no way prohibits any lawful access to cannabis to youth. The second is that children will somehow be allowed to traffic cannabis. And of course, Bill C-45 would not permit that, and it would certainly not permit adults from using youth to traffic cannabis. And in fact, there is a higher sentence which we are proposing, a higher maximum 14-year sentence, which is an improvement from the current regime. And the most important flawed assumption that he makes is that somehow the status quo was working with respect to cannabis, when all of the evidence and all of the efforts which have been put in by the independent task force demonstrates that it is not. And isn't that the trouble, Mr. Speaker, with the Conservatives' approach to law and order, is that it ignores evidence, that it somehow continues to introduce unconstitutional laws which have been struck down by the Supreme Court of Canada, like mandatory minimums, and that they show no faith in our courts, which are situated best to provide justice and safety to all Canadians. Thank you, Mr. Speaker.
The Honourable Member for Niagara Falls.
Well, thank you, Mr. Speaker. I put this question to the Minister of Justice, the honourable member. I probably remember at the Justice Committee here, I think just a couple of weeks ago, what happens to the child who's got 4 grams of marijuana? I mean, we made the point that it specifically says that you can't have more than 5. Well, what about if you got 2 or 3? And isn't this going to be very helpful to people who love to sell drugs around schools? Or you want to get the young people here and say, be careful, don't take more than 5 grams here with you. Just, do the 4 grams, sell that, and come back to see us. But, Mr. Speaker, again, if the honourable member says we don't respect the justice system or everything else, well, that's the point. Does he want to ignore the evidence with respect to impaired driving? Check it out in Colorado. Check it out with all these different jurisdictions. Once they legalize marijuana, impaired driving that has, as a result of smoking marijuana, goes up. There's 32% increase in deaths in Colorado since they have done that. And so, yes, we Conservatives, yes, we're worried about the criminal code. We're worried about the justice system. We're worried about the victims of people who are victims of crime. And that's one of the